Okay. Arifabin, you just need to unmute. Okay. Um, so Assalamu alaikum everyone. My name is Dr. Fatima Kapasi or Fatima Saeed, or Fatima Girnari. I go by multiple aliases. Um, and it's my absolute pleasure to be here today with you. Thank you all so much for logging in. This is now our second health series that we've started. The first one was all on hormone health, and we've completed that. If you missed it and you want to know a little bit about anything hormone related from menopause to puberty, please feel free to log in on the SBMAA YouTube page. If you're not sure how to get there, just let me know. And I'll help you navigate that. We had the first webinar last week on last month on diet. And so today's webinar is on obesity and weight loss. So let's get going. Before I do, I just also want to say the point of this entire health series is about preventative healthcare. So particularly things that we can do, focusing on our health to reduce the risk of getting illness later on. Okay, so there's quite a few topics. We had sent out the link earlier, but if you need me to send it again, let me know. Um, and on this email, we had actually sent out two. So the next one is on the 1st of December. So without further ado, I'm going to introduce you to a colleague and a friend, Dr. Asifa Bagonwala, or Arifabin, who is a family physician. She's been working in Mississauga for and has over 15 years of experience. She has an interest and a focus in obesity, medicine, and metabolic health. And she works at Intrepid Health Group in Mississauga at the moment in a health team where they work together to deliver patient-centered care, specifically focusing on obesity. So I'm delighted to um, introduce her today, and let her get started. Shukran.
Thank you, Fatima Bin, for the introduction, and thank you for giving me a chance to present on obesity medicine today. I'm very passionate about this topic, and I've recently ventured out um, into obesity medicine. Assalamu alaikum to all. Good evening. Hope all of you are doing well. Thank you for being here today. The fact that all of you are present here today tells us that we are interested in making a healthy change to our lifestyles. So let's discuss obesity as a disease and its management. It's very important to break the stigma of obesity. Obesity is not a personal failure, it's a medical condition. Together, we can change the way we see and manage it. Just like any other chronic diseases like diabetes, high blood pressure, obesity is also a chronic disease which requires ongoing management. The facts about obesity. It's very important to understand that eat less and move more is not equally effective for all. Early life interventions have long term impact on health. Weight loss medications and weight loss surgery does help to reverse harmful epigenetic effects of the weight on our body. Personalized obesity treatment plan is the future of for our health. So, epigenetics about the genes. What do we mean by epigenetics? So, to be very simple, it is DNA is the hardware and epigenetics is the software that is controlling it. What effect does the epigenetics have on our system? It affects the appetite regulation. It has effect on the fat storage and metabolism in the body. It increases inflammation in our body, which in turns causes more weight gain, and it is transgenerational. What I mean by that is mother's environment can shape a child's future obesity risk. For example, if the mother has gestational diabetes or mother is overweight throughout the pregnancy, that can affect the child's future and may put the child at risk for obesity. So let's try to understand obesity. What does obesity exactly mean? Obesity is defined by BMI, which is body mass index, but it is more than just numbers. Obesity means actually excess body fat that is affecting our health. Now, the fat can have two different. There are two different kind of diseases: fat mass disease and the sick fat disease. Fat mass disease is more like a pressure on your body, which causes joint and muscle problems. It causes shortness of breath with activity or exertion. The acid reflux is also common with fat mass disease because of the pressure on your diaphragm in the stomach. Fatty liver disease, heart failure, and last but not the least, low energy levels, which is fatigue. Sick fat disease, on the other hand, is the endocrinal or metabolic abnormalities that the fat can cause in our system, which is diabetes, hypertension, abnormal cholesterols, chronic inflammation. What I mean by chronic inflammation is the inflammation in our body can harden up the arteries, which is the atherosclerosis of the arteries. It can cause pancreatic dysfunction and increase risk of cancers. So the obesity is usually multifactorial. It is not just one thing causing it all. It's a mix of genes, environment, and lifestyle. Now, how do we stage obesity and how do we understand where we are with our weight? So, there are different ways of staging obesity, BMI being one of them. What I mean by BMI is body mass index, which most of us are aware of what body mass index is. Now, the normal weight is BMI of approximately 18.5 to 24.9. Overweight is 25 to 29.9, and obesity is any BMI equal to or more than 30. Now, again, with the 30 plus BMI, again, we categorize into mild, moderate, and severe obesity. Severe obesity is any BMI equal to or more than 40, which is which can have significant health impacts on a person's body. Now, the other way of staging obesity is understanding the effect of weight on our body. Stage zero is where the weight is appropriate and there is no risk to your body. Stage one is mild risk, which means you have already started to see the signs of weight causing problems, which is a slight increase in the blood pressure, some borderline increase in the sugar, mild psychological impact also weight can have, which is low mood and mild anxiety, occasional tiredness and pain, but there is no functional impairment with the stage one. Now, coming to the stage two, which is a moderate risk. So, in this category, the weight has already caused the problem, and we are seeing the effect of weight in which has already caused the disease. So, this is the weight can has caused diabetes. It can cause high blood pressure, sleep apnea, fatty liver disease, osteoarthritis, and there is some moderate anxiety and depression that is setting in because of the excess weight. Some limitation in mobility also we can start seeing at this stage. Now, stage three, which is significant risk to our health. What it means is now the blood sugars are not very well controlled, blood pressure is not very well controlled, there's advanced heart disease in this stage, and there is significant anxiety and depression because of limitations in functional day-to-day activities, and of course the day-to-day activities are limited because of limited mobility. Now, stage four is severe risk to the health. What it means is end stage obesity related diseases, which means diseases are not reversible anymore. There's already organ damage that has happened, and there's very poor quality of life, severe difficulty performing daily tasks due to mobility. Life threatening complications can happen at this stage. Health staging predicts health outcomes better than BMI, helps to guide treatment intensity and personalized weight management plans. Now, the other another way of looking at weight is looking at the body composition of every individual. For example, why body composition is important? Let's try to understand that. BMI is a good starting point to assess weight, but BMI is not very appropriate tool for assessing a patient's body weight. The reason why, I'll give you an example. If I weigh an athlete, the BMI may be 35, and if I weigh a non-athlete, his BMI could also be 35. But does it mean that the athlete is not healthy? No, it doesn't mean that. The reason is because the athlete has more skeletal muscle mass and less of the visceral body fat, whereas the other person with the BMI of 35 could have more less skeletal muscle mass and more of body fat. Body fat is the one that is responsible for all the diseases that we develop because of excess weight. Now, what does the body composition machine measures? It looks exactly like what you see in the picture. It's a very good tool for in-office analysis of the body fat mass and percentage, visceral fat, lean body mass, skeletal muscle mass, bone strength, and total body water. Another tool that we use in our practice to understand the heart disease risk or the cardiovascular risk is the waist circumference. This is a very good predictor of cardiovascular risk. A waist circumference of more than 102 centimeter is considered high risk for men, and a waist circumference of 88 centimeters is considered high risk for women. Now, why is obesity called a disease? Because it affects how the body works on a biological level. Um, Fat becomes an active organ that releases harmful chemicals. It disrupts the hormones in our body and it affects our metabolism. The brain and the hormones protect us from fat storage. And your body is not against you, it's trying to survive, and that's how it survives. What are the causes of obesity? So, as I said earlier, it's a multifactorial disease. There are various factors that are responsible for the weight gain. And it's a few being genetics, diet, inactivity, stress, sleep, and medications can all contribute equally for the weight gain. Most people experience more than one factor. You're not alone. It's not just food or exercise, it's about your environment and biology. Health risks of obesity. I've said many times that what impact excess weight can have on the body. And some of the diseases that we commonly see are diabetes, heart disease, joint pain. Person may have osteoarthritis, may not have person with excess weight, the osteoarthritis will progress faster. Whereas person with normal weight, the osteoarthritis may stay in the milder stage for a very long time. Sleep apnea is also very common. There's a 30% higher risk for people with excess weight for developing cancer as compared to a person with normal weight. Infertility, again, is very common in people with excess weight. And last but not the least, urinary incontinence is also very common. Obesity impacts long term health, but there is hope. Every 5 to 10% weight loss improves health. The good news is obesity can be managed. Step by step, change is possible. Every small step counts. Even walking 10 minutes a day or cutting one soda makes a big difference. So, how do we manage obesity? There are pillars of obesity treatment, and it's important to address all these four pillars. A person cannot choose and pick that I'll only diet, I'll only exercise, or I'll just do behavioral management or medication only. It does not work. You have to address all the four pillars to see better results. So, the pillars that are used are nutrition, exercise, behavior management, medical therapy. Under medical therapy, we have medications for weight management and weight loss surgery. Small steps, big wins. Aim for realistic goals. Even 5% weight loss can boost your health. Progress is important over perfection. You don't need to change overnight, just change the direction. Let's talk about nutrition for health. What you see in the picture here is a plate from our Healthy Plate Canada website. I love this plate. I advise most of my patients to take a printout and put it on the fridge. So whenever we are filling up our plates, just look at what the plate has. As you can see, half the plate has fruits, vegetables. The other half is divided into two quarters. One quarter is has all the proteins, where the proteins could be tofu, paneer, yogurt, eggs, all the beans, and of course the meat. And then the other quarter has carbohydrates. So in carbohydrates, it's better always to choose the brown carbohydrates rather than the white carbohydrates. Portion control is very important. Restrictive diets work, but they're not sustainable in our busy routines. The maximum I've seen a person doing a restrictive diet, if you have a very strong willpower, it's maximum 6 to 12 months, not beyond that. And the moment you give up the restrictive diet, all the weight comes back, and it comes back with a vengeance. Starving is not required. Food noise is real. So let's talk about exercise now. There are two intensity of exercises that are recommended: moderate intensity exercise and a high intensity exercise. Moderate intensity exercise, the recommendation is for 150 to 300 minutes per week. Now, the examples of moderate intensity exercises: brisk walking, easy cycling, dancing, playground play. Now, how do you know whether your exercise is moderate intensity? The exercise where you can talk but not sing during the exercise is the moderate intensity exercise. And with moderate intensity, you will not see any weight loss. Even if you combine it with nutrition, the dietary restrictions, you may see some weight loss with the dietary restrictions, but not because of the exercise. Moderate intensity exercise is usually recommended for weight maintenance and not for weight loss. Now, coming to the high intensity exercise, the recommendation is 75 to 150 minutes per week. During this exercise, you cannot talk and you cannot sing. Helpful in losing weight. So, this can, if you combine with nutrition and diet, this will definitely help you lose weight. The examples of high intensity exercise are running, fast cycling, playing soccer or basketball, swimming 10 or more laps, jumping ropes, and tag games. And the exercise for children, how do we encourage our children to be more physically active? This starts right from childhood. So from 3 to 5 years of age, the recommendation is they should be active throughout the day. No set time is required for 3 to 5 year old children, but aim for minimum 3 hours of physical activity. Now, the older children and adolescents, 60 minutes of moderate to vigorous activity per day is the recommendation. And the screen time, which is the biggest killer and the reason for most of our weight gain nowadays, is should be limited to 2 hours per day. And that's not applicable just for children, it's for adults as well. Now, sleep and stress are also big factors in affect causing excess weight gain. Poor sleep and high stress can affect hormones, which is it causes release of cortisol. Cortisol in turn causes release of the hunger hormone, the ghrelin, which increases the food noise in the brain, and you constantly are looking for food to get the energy. Stress eating and emotional eating is real. Use relaxation methods like deep breathing, journaling, or short walk to help relax yourself. Cognitive behavioral therapy, it's a big game changer in weight management. A lot of patients, when I approach them for cognitive behavioral therapy, they feel, why are you asking me to do this? I'm not anxious, I'm not depressed, I don't need the therapy. The cognitive behavioral therapy is not for mood management here. It is to change a person's habit, how they manage their food and eating habits. So basically, it trains you for mindful eating. It also helps with stress management and increases their coping abilities. So it's very strongly recommended that when you were pursuing weight management, do not ignore this pillar of weight management as well. Now, medical management of weight. Doctors can help with personalized plans, medicine, or surgery if needed. Getting professional support isn't weakness, it's wisdom. Now, the options available in North America, the medication that are approved for weight management are as listed in the on the slide. I'll talk about a few of them. The most popular ones. Contrave is a combination of naltrexone and bupropion. It's a two different medications in one. One affair decreases the appetite, the other one decreases the cravings. And it has, we have seen some good results with Contrave as well. A person may lose up to 15 to 20% of their total body weight. Um, and it's probably one of the most cheapest medication on the list here. Then comes the Ozempic, which we all have heard about. It's all over the social media, one of the most popular medication in Hollywood and Bollywood. And what is Ozempic? Ozempic, Ribellicis, and Wegovy all are the same salt, the semaglutide. They're all GLP-1 analogs, which suppresses the appetite, keeps the food longer in the stomach, does not let it move. So when the stomach constantly has this feeling of fullness, there will be less hunger hormone being released by your body, and there will be more fullness hormone. That's how it reduces your appetite and helps you lose weight. The other medication, which is top of the line, is Monjaro and Zepbound now. These two medications are the combination of GIP and GLP-1 analogs, and these medicines have shown very promising effect. They have shown at least 30 to 35% of total body weight loss. Qsymia is another one that has been approved in US as a combination for weight management, which is phentermine and a combination of topiramate. It's not approved in Canada yet. Now, a lot of patients have questions about, I don't want to use medications for weight management, I don't want to look sick. Yes, if you will lose a lot of muscle mass if you just take the medication and not follow the recommendations for the weight management as advised by the physician. So, muscle mass, whenever you're losing weight, muscle mass is the first thing a person loses, not the visceral body fat. And if you want to see results, and if you want to see sustained weight loss results, then it's very important, along with the diet, exercise, a combined diet and exercise with medication. Exercise usually to lose the visceral fat, strength training is recommended at least 20 to 30 minutes, 2 to 3 times per week. Now, the another topic which a lot of us like to stay away from is the bariatric surgery, which is the weight loss surgery. There's a lot of fear about the weight loss surgeries. But whenever I consider my options for treatment, I always look at risk versus benefit. If the risk is very low and the excess weight is going to cause a lot of complications with my health, I would choose the bariatric surgery without any other I wouldn't think twice about doing the bariatric surgery. Now, the indications for bariatric surgery in Canada, or at least in the province of Ontario, is if you have BMI of more than 40 without any health issues, OHIP will cover your bariatric surgery. If the BMI is between 30 to 35 to 39.9, it has to be accompanied with some health issues like diabetes or high blood pressure, sleep apnea or fatty liver, or severe arthritis. Then OHIP will cover the bariatric surgery. Support and accountability is very important in your weight loss journey. Share your journey, find a partner, or join a support group. It's very important for the ongoing support during your weight loss journey. Highlight that success is easier with encouragement and teamwork. Mindset is very important and it definitely matters. Replace I can't with I am learning. Replace I failed with I tried again. This is a journey, not a test. There's no failing if you keep going. So let's talk about a real success story that comes from my practice. Um, this particular patient, sorry, I'll have to go back. Okay. This is a 40-year-old female who came to me in 2024 August. She has multiple sclerosis. Her mobility was severely limited because of her neurological condition, and her BMI was 45 and above. With the lifestyle changes, some little dietary intervention, she started walking on the walking pad at home to keep herself physically active because she could not manage the strength training with her current BMI and mobility issues due to her underlying medical condition. And we used medication for her with her. We used the medication Contrave because she could not afford anything more expensive. So again, Contrave is the combination of naltrexone and bupropion. Today, 2025 in November, her weight is down by 30 pounds, which is approximately 15 kilos. Her BMI is down by 5 points. She's now 40 BMI. She's much more happier. She is much more mobile, and she has a lot more energy to go on about her life. So changes can be made. It's just focus on mindset transformation. Now, it is important to understand that progress is important, not perfection. Every step that you take, it counts. You're not too late, you're just getting started. Let this quote sink in you tonight. Reflect which of these messages speak to you today. Now, the takeaway message from this presentation is obesity is a disease, but we can manage with knowledge, effort, and compassion. You deserve health and happiness. Let's rewrite your story one healthy choice at a time. Thank you once again for being here. Let's make the change together. You're not alone. We are here to help. I'll be happy to answer any questions that you may have. Please do not feel shy. Every question is a good question. Thank you.
Thank you so much, Arfabin. That was really good, really, really good. I think, as you mentioned, it's a really important topic, and it's not been treated as such for such a long time. And I think everyone thinks or associates obesity with having to stop eating. And I think that's a really important point, right? And also the other message that you mentioned about um that it's not, well, I failed. It's I'm trying again, because often, even when we're on this journey, something comes up and then you kind of fall off that bandwagon. It's about getting back on there, right? So yeah, thank you. That's really useful. I am going to stop the recording for this, but um so feel free to ask questions. If you feel like you don't want to ask them in person, put them in the chat box and we can get through them.
Arifabin, this is Farida Pambor. Can you hear me?
Yes.
Yeah, so thank you so much for that presentation. Uh, I wanted to ask, do you, like, so apna muh mein nain, right? Uh,
Mm-hmm.
apne, like, we go for ashara and we're sitting for long periods of time. Even apne, then, the thali jaman, the majority of us are taking the thali jaman. So apnu, there is a certain kind of commonality in our lifestyle, in our diet,
Mm-hmm.
and exercise or lack thereof, whatever. So, can you comment on some of the things that are part of the Apna Muminin lifestyle uh, that are kind of probably, we can, what am I looking for? So, some
So,
things we need to kind of counterbalance, if you will, uh, so that we can maintain a healthy weight. I hope
mm-hmm.
that question makes sense.
So you're trying. I think I am getting a part of your question, not the entire. But let me answer. Let's break down into two. The first concern was about going for ashra and sitting for long hours for the vase, right? So
Right.
during the vase, you have the option of standing and just standing, right, and moving wherever you're standing. You don't have to sit for a long time, the long hours. People with back pains and all that also have you're allowed to stand up and stretch. Doesn't mean that you all stand and walk around, because that would be disturbing the vase. And okay, for the 2 hours or 3 hours of hours, if you're sitting, that we do at work as well, right? It's not that we are not sitting at work. Doesn't matter what kind of work we are in, there's some sitting involved, in some professions less and in other professions more. But you can do your exercise beforehand, you can do your exercise after the vase. It does not have to be during the vase, but of course, stretching, if you want to do, you can definitely manage that. Now, regarding the thali jaman, I yes, it is a concern that thali jaman, but then now I believe they've introduced the healthy options as well. So you can offer the healthy options. You don't have to go for the other options of the gravy foods or high calorie foods. And that probably will help as well. And again, as I said, I'm not a big fan of recommending people to completely eliminate a food group from their diet. Portion control is very important. Even if you're eating thali food, instead of getting fill a half your plate with vegetables, as we saw on the healthy plate Canada, and the rest half you can go a little bit, half a roti, and take some gravy, or take more of protein. Just take the boti, don't take the gravy, and that can be managed as